So good afternoon. I'm Kerry Bruce, and I'm very pleased to be here and really energized by the conversations that we had this morning. And apologies for shifting now into the talking heads mode. Somebody said this morning, disparaging about PowerPoints. Sorry in advance. So I work for Pact, which is an international NGO based here in DC. We work in 25 countries around the world. And how I came to BetterEvaluation is through our work in evaluation. We commission and manage probably between 5 and 10 internal evaluations of projects per year. And then we also manage external evaluators from our donors who come in and have kind of relationships with them. So that's how I came to BetterEvaluation, but what I want to do today is kind of walk you through a framework that they've put together, which I find is very helpful, if I can make the technology work. So just before we jump into the framework, though, when I'm talking to a health crowd, I like to take a minute to just step back and think about the differences between research and evaluation, because especially in public health, we are trained in research. We are increasingly trained in evaluation, but that's not normally part of what we learn in school. So research is really a much more empirical approach. It's looking at generalizable knowledge, whereas evaluation is really looking at the outcome of an intervention. And the uses of research and evaluation can be quite different. So, sorry. Hello.
We're working on getting that up.
Thank you. Research and evaluation can either overlap with each other, or it can be, evaluation can be a subcomponent of research, or the opposite. And it really depends on your context, what you need and what you want. And I think walking through the framework will also help us to understand that. So why do we need a framework? Why would that be of interest to us? When you are starting an evaluation, when you're going out to look for resources, normally you start with, Google, perhaps, or you have evaluation books that you used in school, which are static resources. But there are very few places in the evaluation community where everything is pooled together. And the BetterEvaluation site, which is a website with a lot of resources on it, is actually an active community of practice around evaluation. And we encourage you all to join and be part of that community, make contributions. When you have a method and evaluation that you want to share, to put it on there, onto the website, and participate in the process. So normally when we start out, we often have this kind of head-scratching moment. And the BetterEvaluation process was started in order to help people know where to start, how to start. Otherwise, we often end up in this situation, which is we default to what we know, right? We pick the method that we used in our last piece of research, our last evaluation, and that wrench might not fit that nut. So this is the rainbow framework that BetterEvaluation has put together, and we're going to walk quickly through the different parts of the framework, and then we'll come back at the end to the manage piece of it. So we'll start first with define. So first, in an evaluation process, one good place to start is to define what is to be evaluated. And why would this be of interest to us? Who cares? I mean, let's talk about what our sampling is. How much money do we have? Jump to those things. If we think about the definition of an evaluation, we can be much clearer about, are we looking at the apples in the basket, the oranges in the basket, or all of the basket in our evaluation process. So in the framework, there are 3 key questions. Sorry, I keep turning my head. Maybe I can stand here, it'd be easier. Sorry, let me turn that off. I can't see the slides, so I apologize. So there are 3 key questions that we ask ourselves in the define piece. Thank you. Around developing an initial program description or theory of change and logic model, and also to identify potential unintended results. This is really important because you'd be surprised in the number of evaluations we do where you go in and say, right, okay, so where did we start? And people are like, oh, well, we never wrote that down. We don't know. We just know what we're doing. Aha. Let's all be sure that we've documented we know what we're doing and how we think our theory of change is going to work. Very important in an evaluation process. The second part of the framework talks about what the framing of the evaluation. And in research around leadership and who makes a good decision, we find that leaders who make the best decisions stop to frame their decision. Who needs to be involved? We heard a lot about that this morning in the community discussion. How will the results be used? So in framing an evaluation, we want to think about it in the same way. Before we jump to design, we want to frame the evaluation. And the key questions we ask here are, who are the primary intended users? We decide on the purpose. We figure out the key evaluation questions. And also it's very helpful to determine what success looks like. If we do this evaluation well, so what? The third part of the framework is describe. And this is what I think as health practitioners we all jump to. It's the methods. It's what are we going to sample? How are we going to collect our data? How are we going to manage our data, analyze our data, visualize our data? This is where we tend to spend most of our time in evaluation, but there are a lot of other pieces that we need to consider. So on the websites, for each of the areas that I've been describing, there are hundreds of resources that talk about each piece of the framework. So this is an example from the describe piece that's just about sampling. So if you have questions about a particular sampling method, you can go to the website and click and find out a description of it, but also examples of people who have used it, which I find the most useful piece of it. And through your participation, you can make it even more useful. In evaluation, we also need to understand the causes of our results and our outcomes. And one of the things that we see when we look at outcomes and impacts, which can be defined differently in different sectors, but essentially are the kind of so what of an intervention, what happened to the people or the things that we were working on, is when we start to talk about causation, as evaluators, we often either oversimplify or overcomplicate the process. So an example from this morning could be if we do the Wellville Community Project in these 5 communities, we can say that it was the Wellville community that reduced obesity in our evaluation. If that was a finding, that would be a good example of how to oversimplify the problem. There are probably lots of factors that played into a reduction in obesity in any particular area. By the same token, we can overcomplicate it and say, well, we can't evaluate that. It's impossible. We need a giant data set. We'll never have enough money. We do need to think about a happy medium in between that can give us the answers that we need for our program understanding and continue to move forward. So this was a quotation that was in The Guardian about a year ago. In my opinion, measuring attribution is critical, and we can't do that unless we use control groups to compare them to. This is a big question in evaluation. In medical research, it's not been a question at all, but in evaluation, establishing a counterfactual. How will we do that, for example, in the Wellville process? Are we going to pick a county or a city next door and do a measurement process about that? County or city as well? On the website, though, there are some really useful resources that give us information about how different ways we might consider looking at impact and outcomes. The questions we can ask around understanding causes are really making sure that the results that we're seeing support causal attribution, comparing those results to a counterfactual or a control group, and really thinking about what else might have been a factor in the results that we're seeing. The fifth step is around synthesizing data from one or more evaluations. And here really, this is where we get into some of the qualitative questioning, just really trying to understand, did it work? Was it effective? Who did it work for? What ways did it work? And also we can get into questions of value. So here, it gets quite complicated in evaluation, as you can imagine. If it's very clear that all the intended impacts were achieved and there were no negative impacts, you can easily say an evaluation outcome was good. Well done. And the opposite if it was bad. They didn't achieve anything and there were all sorts of negative impacts. That was bad. But the in-between space is where you really struggle to say, is this evaluation good? Are they saying we did well or not? And there's actually a really helpful resource on the website, and there are several, but this is one you might want to look at that helps you think through how better to understand if your evaluation is good or bad through creating rubrics. And these are the questions you can ask around synthesizing. Finally, report and support use of the findings. Often we rush to evaluation to get the evaluation done, to understand what it was that we wanted to know, and then, so what? Who's going to use that information? This is a great cartoon about a lady in an African context saying, oh, I use my evaluation reports all the time. They prop up my desk, they keep my window open. Thanks so much for making that happen. So I think before we jump into evaluation, we really want to think about how we can use our evaluation data in a way that's not propping up a desk or a window. So some of the questions we can ask ourselves at the outset are around identifying the reporting requirements, developing reporting media, ensuring that we know what we want to report. And I think from my perspective in the evaluations that we do at the field level around the world is really how are we going to use that information? If they tell us that our household economic strengthening interventions are not good, so what are we going to do about it? That, to me, is the power in evaluation. It gives you the opportunity to change and improve. Finally, the overarching piece of evaluation is really around management. And even if an external evaluator is coming to work with you, there's still a big management component. In the BetterEvaluation framework, they've broken it into 9 different components, the first 7 of which are things that you will definitely have your hands busy in. Engaging with stakeholders, understanding how we're going to make decisions about this process. The last 2, review evaluation and develop evaluation capacity, are really around, they're hallmarks of a quality evaluation, where we're looking at synthesizing data and evaluation data. So for example, if we do a separate evaluation in each Wellville community around the US, and then we synthesize those data to really understand the overall impact of the project, that would be a really strong outcome or result. And then developing evaluation capacity. You can't, when people are scared by evaluation, you say, well, I'm going to come evaluate your program. They're like, uh-oh. And then they start to hide everything that they didn't want you to see, rather than seeing it as a process that is positive for understanding potential for change. So in your packets, you'll find, if you haven't already found, there are 2 tools in there. There's what we call on the left the compact version, which is just the questions that you saw here in each of the stages. And it's just a framework for you to think through all of these different all the questions you should ask yourself as you're designing an evaluation. And then there's a slightly more detailed document that starts to provide some more information about things you can do. But really, it's the website that has the information that you're going to look for when you really dig down and start your evaluation and participate in it. Okay, so that's a really rapid overview of the Rainbow Framework. Thanks.